The first time I kicked cold turkey, it was not so difficult as the times after that. Like the first time, it was hard, but I didn't really know what was going to happen. I felt really uncomfortable, like a flu that's coming up, you know? And like you just don't feel right in your body. You have muscle cramps and pain in your bones and all that. And you have this total mental craving because you know that you can just like get some heroin and get out of that feeling right away. But the first times I did it I had so much willpower, you know? I had something like, I can fight this thing. And I would just deal with it. And within like a couple of days, I would be able to function again. And then I would still feel for 2 or 3 weeks a little uncomfortable, but I was able to deal with it. But the more I got into the addiction, you know, as the years passed, the harder it got to do it that way, you know, because also the more you do it and the longer you're hooked, the more your system is used to it, so the more shocking it is for your body to stop from one day to the next. So, I mean, the last time I kicked cold turkey was involuntary. It was when I got busted, and I had to spend 36 hours in jail without anything. And I got busted at a point that I was already getting sick, so by the time I reached the Tombs at downtown, I was totally out of it. It was just horrible. I couldn't eat, I couldn't sleep, I couldn't sit, I couldn't lay down. I just, you know, it was just a nightmare, you know. I've tried to fall asleep. I have these like really short 3-minute sleeps in which I dream a lot, but it's all about that I'm copying, or, you know, weird dreams, like I'm calling my husband on the phone and he's throwing methadone through the phone, that kind of stuff, you know. It's really difficult.
I went to Best Israel for a 2-week detox. What was the problem with detox is that, you know, with Best Israel is once they take you, they use methadone to detox you, and once they stop, by law, when they stop giving you methadone at detox, they have to release you within the day. And when they stopped giving me the methadone, I was starting to get pains. I was feeling very inadequate. I felt a lot of pain. I felt very funny. So when I got out, I felt so screwed up. All I wanted to do was do dope to stop feeling funny. And that doesn't make no sense. I mean, the minute you're feeling normal or you're feeling funny, they throw you out. You know, I think they should at least give you a few days to deal with you, you know, have a psychiatrist, have some kind of therapy before they just shove you out there. It's like they kick you out like a factory. It's like, all right, next, dink.
Okay, cold turkey is like living hell. It's complete torture. Metabolically, you can't, it feels like every muscle in your body is completely tied up. You're completely beyond hope. You can't get out of a state of anxiety and pain for, you know, 72 hours. You have diarrhea, you have stomach cramps, heavy intestinal cramps. When you want to sit down, you can't sit down. You're exhausted, so you lay down. But the second you lay down, you want to stand up. You know, it's basically like the Christian conception of hell. It's just constant torture, living torture.
I'm Dr. Daniel Luciano, and I'm a neurologist affiliated with the New York University Medical Center. I have had the opportunity to evaluate 4 patients who were treated with ENDABUSE. This involved me initially doing a physical examination and performing laboratory tests to be certain that there were no major medical problems.
Okay, we were required to take full medical workups done. EKG, EEG, full blood tests, full examination, you know, total physical by a doctor, and various questioning before we were permitted to be a part of the study.
Now, for those of you who will participate in treatment or research, the ENDABUSE procedure incorporates 3 distinct phases. The first is a stage of visualization, or the release of repressed memories in a visual manner. It's very similar to dreaming, except you are awake. This phase would last anywhere from 3 to 5 hours. It ends abruptly. It's followed by a stage which we refer to as the cognitive evaluation stage. This is a period of 6 to 12 hours in which the patient intellectually evaluates decisions that they've made in their life. In many cases, when we first make a decision, we only feel that there's one decision to be made. But in reality, there may have been 2 or 3 or even 10 decisions which could possibly have been accomplished. Once the patient has this knowledge, it is very easy for them to interpret their past behaviors and correct their past behaviors, which may have led to drug use. The third phase is the most taxing to the patient. This is one of residual stimulation, in which all of the psychoactivity of end abuse has ceased, and the patient is simply awake, and this stage of residual stimulation may last as long as 48 hours. The support and medical staff's principal occupation during the treatment is to keep you comfortable. And we will see that this is done. They will provide food as necessary, liquids as necessary, and help you to get through the procedure.
It was administered to me orally, approximately 45 minutes after I had taken the capsules. I started to visualize my whole life, basically from the time I was born to the present, and it was kind of sporadic flashes of scenes of past and present things, and it happened so fast that I didn't in the first understand that.
I had dreams about the friendship and the breakup of this friendship for years and years after we stopped being friends, and it was something that constantly bothered me on a deep emotional level. And the end abuse sort of told me the whole story of our friendship, why we became friends, why we stopped being friends, what attracted me to him, and it brought me a lot of peace of mind in that and it has to do with heroin too, I think, in that it was sort of a negative, evil energy that I was attracted to, and I saw it for what it was. And by the end abuse making you see this, like before that I wouldn't be able to see that this person was negative, or that heroin was negative, or that things that I've done in my past were negative. But the end abuse basically puts a mirror to your face and makes you see it. And it freed me from, I guess, guilt. And it was just, you just see that you did that, and that you finally understand it, and you move beyond it.
I'm like the tough nut. You know, with me, the first time I took end abuse, I was leery. I remember saying, I don't feel anything. And but meanwhile, when I tried to get up to go to the bathroom, I couldn't stand. So, as far as visualizations are concerned, I felt I saw some things. I believe I saw trees in the wind, and grass blowing in the wind, and ocean waves, but I did not have as many visuals as most of the others had.